Hello, good evening. Can you hear me clearly? Please let me know in the chat box. Thank you so much for joining today's session. Let me introduce myself. I am Dr. Sumbal Ijaz, your MRCOG mentor. So how is everyone doing today? That's good. Hello, Dr. Hira. Hello, Dr. Berin. How are you doing? I'm also doing great. Okay, so quickly let me know how many of you are planning to sit in MRCOG Part 1 exam in January 2027. I'm good, Dr. Amara. Thank you for asking. Okay, in today's session, we will talk about why you should consider MRCOG, and we will also have a short introduction to essential biostats for your Part 1 exam. So let me give you a quick introduction regarding MRCOG exam. It stands for Membership of Royal College of Obs and Gynae. It is one of the most respected qualification in Obs and Gynae, and it is recognized in many countries and help doctors to improve their knowledge and career opportunities. And there are many benefits of doing MRCOG. It gives you a strong understanding of obs and gynae. It improves your clinical knowledge, decision making, and also it opens career opportunities in different countries, and it also adds the value to your CV. So if you plan to work in your own country, the knowledge gained from this exam is very useful for you. And trust me, that would make a classical difference in your clinical practice. And many people think MRCOG is impossible to pass. It is definitely challenging, but it is not impossible. With the right guidance, a proper study plan, and regular practice, you can pass the exam in first attempt. And before we dive into this session, I just wanted to give you a tip in the very beginning that consistency is more important than studying for long hours only once in a while. So, what I'm trying to say here, if you remain consistent with your studies, no matter what you are studying for 4 hours or 2 hours or 6 hours or 8 hours, whatsoever, but yes, if you remain consistent and even you are trying to manage 2 to 3 hours per day in this coming 6 months of the time, then definitely you can pass the exam. Okay, Dr. Hira, I have noted your question, but I would address all the questions in the end of the session. Would be that fine? Okay. So by the end of this session, you would understand why MRCOG is one of the most respected postgrad qualification, whether January 2027 is the right attempt for you, who is eligible to sit the exam, and this is one of the most frequently asked questions by the candidates, and what career opportunities MRCOG opens for you, how to prepare effectively over the next 6 months, common mistakes that led to failure, Even I have seen many competent doctors who fail this exam by making some common mistakes, which can be easily minimized if you have a proper strategy. And how to maximize your chances of passing on your first attempt. Sure, Dr. Berin, I have noted your question. Okay, before we proceed, we have a very limited time offer that we are offering our premium course in just $100. So also keep this in your mind. Okay, so as I have mentioned earlier, what is MRCOG? It is a royal membership of the Royal College of Obs and Gynae, which is a globally recognized postgrad qualification in Obs and Gynae. It is designed to assess the knowledge, clinical understanding, and professional standards required in the Obs and Gynae clinical practice. So classically, it has three parts, part 1, 2, and 3, and how they are different from each other. In part 1, they classically assess you on your basic knowledge, your foundation regarding the basic subjects like anatomy, biochemistry, physiology, all those subjects which we have covered in our medical school during the foundation year. Then in the part 2, it is classically focused on how you manage clinical scenarios. Like there are a lot of guidelines there are many modules, including both Obs and Gynae, and there are many guidelines which covers all the aspects of the clinical knowledge of Obs and Gynae. In this part 2 exam, they never ask the basic questions from your core subjects. So for part 2, you just need to cover all the guidelines. Then in part 3, it is a OSCE type of exam. And if you have passed part 2, then there is nothing to worry about part 3, because all in the part 3, you need to work just on your interpersonal skills, how you communicate with the patient, how you can convey your ideas, and how you are going to counsel your patient. And as far as the management part is concerned, if you had cleared part 2 exam, that would be no more challenging for you. So why do doctors go for MRCOG? Because it provides internationally recognition. It also builds your resume. It provides you with a strong academic profile. It also improves your career opportunities, better preparation for specialist training. It also helps your professional development. It also provides you a competitive advantage in many healthcare systems. For example, as Dr. Hira just asked me this question, like she has already done her FCPS in Obs and Gynae, which is a very wonderful thing. I really appreciate that. And then she asked that why she should go for MRCOG, because she thinks that it is a long pathway. Yes, indeed, it is a long pathway, but it is not as longer as FCPS journey. So what I believe, there is no limit for your career development. Even if we talk about our personal growth, there is no end for that. As long as we are living, if you really want to progress in your life, you need to do something. And in every day, we learn new things, we improve day by day. Similarly, when it comes to our professional life, there is no end. Even if I have seen so many doctors, even at the very senior level, they do learn at that level as well. So there is no end for the learning. And definitely, if you already have FCPS and then you go for MRCOG, you would definitely stand out with the rest of your colleagues. Why January 2027? Why it is a suitable exam? Because it provides the excellent opportunity. You have enough preparation time without any unnecessary delay. So you can utilize these coming 6 months and you can prepare for the exam without any stress. And yes, when you are stress-free, you can study more effectively. So if you start your preparation by now, it would give you enough time to build strong concepts. Why I'm putting emphasis on giving some time to this exam, although I have seen some students who cleared the exam in 3 to 4 months preparation time. Uh, but there was a difference. Those doctors who just graduated and who are just done with their house job, they have their knowledge is quite fresh regarding the basic subjects, so they can quickly cover up the exam. But there are different scenarios as well. Like there are many candidates who are working, who are doing their training. There are some doctors who are looking after their families as well. So for them, 3 months time is not enough. So it would be a good idea, even for both types of candidates, it would be a good idea if you start your preparation as soon as possible, so that you can have strong concepts, you can cover all the major subjects, you will get enough time at the end for practicing SPS. I think someone's mic is on. I would request to turn off your mic. Okay. Okay, so what is another advantage by starting your preparation by now? That at the end, you will get enough time for the revision. And trust me, SPAs, they seems like very simple questions, but RCOG loves to twist the SPA. Even the very simple SPA, they can twist that question, and you will wonder how I had lose my marks and how come I failed my exam. So that's why practicing is the key part to ace this exam. And you should have enough time at the end, at least 2 months, for the revision and practice of the SPAs. Okay, so this is the frequently asked question, like who is eligible for the exam, because there are different myths. Uh, Initially, like I think 5 years back, the criteria for sitting in MRCG exams was different by RCG, but now those who just graduated, those candidates who are doing their house job, or those who are working as a medical officer or residents, or the doctors who are interested in pursuing their career in obs and gynae specialty. Uh, all of these can sit in MRCG Part 1 exam. And those who are planning to move to the other countries, this is the best opportunity for them. By now, consider the current circumstances, especially if I talk about the England. So there are some restrictions now. There's a lot of saturation at the junior level post. So MRCOG would definitely going to help you in your resume, and definitely if we compare the candidates who are applying for a job with MRCOG exam and those who are applying for the job with just GMC by passing PLAB exam, there is a huge difference in both resumes, and the chances for you to secure a job by using this pathway, the specialist pathway, it would help you to secure the job quickly as compared to those who just have GMC. So securing a job is a whole different topic, but today I will try my best to be focused on the introduction of MRCG exam. So should you wait another year? So it happens. It is a very natural thing. I also did this many times. Like whenever I think about to write an exam, and maybe part 2 exam, part 3 exam, or any other exam, initially I need some courage or motivation. And if I don't have that courage or motivation, I try to delay the exam. And I totally understand everyone goes through from the same scenario. So many candidates delay their first attempt, believing they need more time. Delaying, but what happens if you delay your exam? You lost your momentum, the motivation is gone, delayed career progression, increased competition, high personal and professional pressure. And honestly, I'm going through from all of these because I have also delayed one of my exam. So I need this motivation as well. So we are on the same page now. So please, this is for me and this is for you. This is a tip that we should, whatever we are going to give the exam, we need to book that exam and we have to make up our mind. So the next thing is January 2027 realistically achievable? So the answer is absolutely yes, 100% yes. You can, if you start preparing for the part one exam by now, you can definitely pass the 2027 attempt. So again, we have approximately 6 months of time. So what you can do, you can master all the core subjects, complete systematic revision, practice SPAs, solve recall papers. You can sit multiple mock exams as well. So again, I would encourage you to start your preparation. There's another thing. Now the things are quite different because of the competition. Like if I compare when I wrote my exam, at that very time there were not a lot of people who are going for this exam, so the merit was quite low. But now, since everyone wants to pursue their career, now the people have this orientation, they have those that kind of awareness that we need to compete globally. So, with that awareness, and yes, the inflation and each home country, there are their own circumstances. So people try to grow out. And now, because of that situation, even the MRCG Part 1 exam, it is quite competitive. In the previous year, it was not that much competitive, so the merit was quite low. But now, this is also like PLAB exam or like any other exam. This is a competitive exam, so we cannot take any risk. Okay, Dr. Noor, I have noted your question. Do give me a reminder at the end as well, although I would try my best to answer all of the queries. So now we gathered some information regarding MRCG exam. Now we know some of the importance, and now we are motivated enough to do something big in our life. So the next thing is, if we talk about MRCG Part 1 exam, what is this exam? What are the questions, what is the exam format, and what is the time for the exam? So here's the answer. So basically in part one exam, we have two papers, paper one and paper two. And both the papers, they would have the equal amount of questions, which is 100, and they also have equal amount of time to solve those questions. So in paper A, you will get 100 SPAs, and the time is 150 minutes per paper. And in both papers, you need to pass both paper A and paper B in order to clear the exam. So you should be knowing for the MRCG part one exam, that what is exam structure, which I have already told you, that it has part one, paper A and paper B. Both consist of 100 questions each, and the total number of questions is 200, and the time duration is 300 minutes. Okay, so now you know the exam structure. So what should be your next step? You should be knowing the exam calendar, that at what particular date the exam is going to be taken place. Then you should be knowing the exam fee, then the eligibility, how you're going to book the process, book your exam, what is the study material required. And these are, I know it is a lot to know at this very moment, but trust me, everything would be sorted out one by one. Uh, all you need to have some patience and keep your momentum going on. So as far as the exam calendar, I have checked 3 days ago. They haven't shown any dates for the upcoming exam, but I will keep on checking. And once I found the exam calendar, I will share that with you. For the exam fee, it is roughly around, it was £605 for okay, the exam fee depends on your band. The fee for the band A would be different, for B band it would be different, and for band C countries it would be different. And how would you know your band? On the website of the RCOG, they have provided the list of the countries who fall in band A, B, and C. All you need to do is to check that list and find out your country, and according to that, according to your band, your fee would be decided. Then we have what is eligibility. I have already mentioned who can go and sit the exam, but there is a process for that. First of all, I have made a slide. I will show you in a while that how you will proceed with this process. How would you are going to book the exam? For now, all you need to know what is the exam structure and how you can begin your exam preparation. This is the important thing and for at the moment. Okay, so one more time, eligibility for the part one is your only primary medical qualification is required, which is your MBBS degree. If you don't have your degree, you can use your home country medical license. So both have the equal weightage. Uh, so that means if you have just graduated, you can apply for the eligibilities to sit in this exam. Okay, so the recommended books for the part one exam is Oxford Revision Note, Essential Revision Guide, Endosizer, 550 SPS by Catherine, SPS by Ankush Roth, Get Through SPS. So there are a lot of books in the market, but I would recommend you to try to stick with some of the selective or highly recommended books so that you cannot get confused. And over the top of that, the most important thing is to practice the recalls question. So out of these books, the first two, Oxford Revision Note and Essential Revision Guide, these two books, they are the theory books basically. You can, if you have time, you can go through from both the books, but it's all up to you. You can go and pick just one book. That's also enough for your exam. So for the theory, RCOG recommend Oxford Revision Note and Exams Essential Guide. Both the books are available in the PDF form. You can get them. Then for the SP practice, which is the challenging thing, what you can follow Catherine, 550 SPS by Catherine. Then you can also practice alongside your theory. You can practice SPS from the past MRCOG. It comes into volumes, volume 1 and 2. So I highly recommend you to start your preparation from any of these theory books along with practicing SPS from MRC from past MRCOG. Dr. Zamina, it all depends. Okay. Hey, Dr. Zamina, it all depends what type of theory you want to study. Basically, the difference between Oxford and Essential Revision Guide is that in Oxford, they are the information is in the pointer form. Like if you want to study just to the point, then Oxford is a good option. And in Essential Revision Guide, it has a lot of theory. So if you want to study, if your study style is like that, you understand better with the theory, then Essential Revision Guide is good for you. But if you just love to learn from the pointers and just to the point and just quick revision and quick study, then Oxford is a good option. Yes, MNL, you can get that book. That is also available in the PDF form. Hadil, just pass MRCOG is not enough. I'm so sorry to tell you that. You need to have some prior knowledge, some basic, some basic concepts, and then you can practice SBAs. And just pass MRCOG doesn't cover your curriculum. I'm so sorry to tell you that. Gulnaz, there's no need to cram the curriculum. If you just listen to the lectures, it's all up to you. You can watch the videos on the YouTube. You can take any course and watch the lectures. and with the free mind, without any stress, just understand the concepts, because the theory is not going to come into your exam, so there's no need to cram anything from the theory books. I never ever recommend the students to go and cram theory, because that is not going to help you in the long run. What matters in the exam is your SPAs. So the more you practice SPAs, the more you understand what is the mindset of the examiner, what type of information RCG is expecting from you. Once you understand those strategies, things are very easier for you. So the smart study is the right approach for this exam. I hope you get my point. Okay. So now we know like a bit for the study material, like what study books we need to begin our preparation. Meanwhile, I wanted to give you an overview how you can initiate your exam booking process side by side. Okay, so first of all, what you need to do now is to go to the RCG website, create an account there. It is as similar to making any account on any, like if you use. I hope all of you must be using many apps, and you must be familiar how you can make an your account on any app, how you going to subscribe any application. This is as similar as RCOG account. You just go onto the website, click the sign up button, and register your account. Okay, I would request everyone to turn off their mic. Okay, I don't know how to mute someone's mic here. Let me check. Give me a second. Okay, so mics are off. Okay, once you sign up on the RCG website, the second step is to apply for the eligibility. And why I recommend you to do this step by now, because getting the eligibility from RCOG takes some time. And I have seen many candidates who cannot appear in their respective exam. Why? Because their eligibility was delayed. So this process is quite slow. So try to do that. Maybe you can apply for the eligibility by today. So do this by now, so that at the end you are not stressed by your eligibility email. Then you need to submit the expression of interest, which is not opened yet. But once that is open, you need to submit your expression of interest that you want to sit in 2027 exam. Later on, when the booking window opens, we will conduct another session. It would take some time, so we are not going to waste time on these steps, like how you're going to book the exam, how you're going to pay the fee, and how you can book your exam center. So those are the things for the later on. For now, what is your task? You need to do your eligibility. Okay, everyone with me? If anyone have any confusion till now, please do let me know. Okay, Dr. Gulnaz, I would recommend you, since with every day the competition is very high, the passing percentage is going higher. So I won't recommend you to take such a big risk that without any prior knowledge, basic understanding, without knowing any concepts, don't take this risk. You have enough time, and in this 6-month time, you can cover that easily. So there is no rush. So I wouldn't recommend you to take such a big risk. Okay, so now I hope we have a better orientation regarding the exam, regarding the curriculum, and everything. And now we know what is the study material required. Now the point is how we are going to open up our books and what we are going to study from there. So I would explain this by giving an example. Let's take the example of anatomy. So let's imagine all of you and me, we are going to start. This is our day one, and we are starting our part one exam preparation. And on the day one, what I have opened my anatomy. In the anatomy, there's a very good perk for of this exam that all you need to focus on the anatomy, the regions of the anatomy which are relevant for obs and gynae. And the classical regions are anatomy of abdomen, pelvis, and perineum. So there is no need to waste your time on studying neuroanatomy, anatomy of the thorax, anatomy of the upper limb, and lower limb. So it is a huge relief. The students who found anatomy very challenging, so this is a very good news for them. So all we need to cover on the three regions, which is anatomy of abdomen, pelvis, and perineum, without any doubt. And in anatomy, there are some specific topics which RCG loves to ask about questions. So while, for example, I have started studying anatomy from the Oxford Division Note, and now I'm trying to studying everything. But there's in the theory books, there's a lot of knowledge, and sometimes some points are very extra. I'm not saying that you don't read everything. Yes, you can go through from all the lines and all the theory points, but out of those topics, you need to extract what is high yield topics, what are the examiner's favorite topics, so that by the end, I know we are not able to revise everything, and we are not able to keep everything in our mind, especially if I talk about anatomy, that is highly volatile subject. So the purpose of focusing on the high yield topics is that at the end, those limited topics, you can easily revise them. So this should be your goal while you are studying from the theory books. Then we have organized all the curriculum. With each module, we have organized them into mini schedule. That means we are giving you the task daily that these are the topics you need to cover this by today. Then what else you can do? You can join our live sessions to clarify basic concepts. You can also practice SBS in the Telegram group every day with the mentor. You can also practice subject like exam like questions, which are segregated according to the each module. And once you complete this way your first module, for example, anatomy, then at the end you can also solve mock exam. And you can also get the opportunity to get evaluated by the mentor. Okay, so what are your modules? In your curriculum, the subjects you need to cover is anatomy, physiology, embryology, genetics, biochem, pharmacology, pathology, microbiology, immunology, endocrinology, biostats, clinical management, and data interpretation. So these are your subjects you need to cover. These would cover both of your paper A and paper B. Is everyone with me? Okay, what makes candidates successful? What are the tips? The candidates who followed a structured study plan remained consistent. They focused on high yield concepts. Along with that, they also practice SPS daily, and at the end, they revise them regularly. They also attempt mock examination. Mocks are really helpful. They give you an idea beforehand that where you are exactly standing in terms of exam preparation. And also, they have covered previous recalls twice or thrice. So these are the things you need to keep in your mind rest of these coming 6 months, that I have to cover all of these things so that I can pass my exam in first go. And what are the mistakes that candidates made, which led to their failure, unfortunately? It is not due to the lack of intelligence. The problem is okay, from my experience, I've seen that they didn't follow the proper strategy. Even they were hardworking, they studied 7 to 8 hours per day, but their strategy was not their strategy wasn't compatible with this exam. So what are the rest of the mistakes? Starting preparation too late, Ignoring recall question, this is a huge blunder if you do that. If you don't go through from the recalls, I'm so sorry, then it would be very, very difficult for you to pass the exam. So this is the core to pass the exam. Then poor revision strategy, studying without a schedule, insufficient SPF practice, and not analyzing and correcting your mistakes. So I have experienced all of these things. I have failed my FCPS Part 1 exam many years ago. Uh, Although I have prepared, I used to study 8 to 12 hours every day because I was preparing for my ML exam that time. So I was very sure that I know a lot of things. My basic subjects are very, my foundation, my concepts are very good. Still, I failed FCPS Part 1 exam. And when I did some self-reflection, then I get to know that my strategy was not good. The problem was not with my knowledge or my intelligence. Basically, what I didn't follow the right strategy to pass the FCPS Part 1 exam. So I made all of these mistakes during that time, but now I know how to tackle each exam. And honestly, whatever exam you're going to give, every exam has its own strategy. If you know, and if you know that trick, that what is the particular strategy for to pass this exam, then half of your job is done. And same is the case with MRCOG Part 1 exam. So again, I am endorsing that again. Smart strategy is the key, and yes, the second thing is the revision. The more you revise SPAs from the recalls or you practice SPAs from any source, the more are your chances to pass the exam in first attempt. Did you get my point? So again, your clear path is that you're going to work on your concept building first, complete your major subjects. You need to practice SBAs along with your theory. Then at the end, by November, December, and January, you're going to revise your recalls. You are going to give mock exams, and in January, final revision, and you are done. An effective preparation strategy should include high-yield lectures. You should have concise study notes so that you don't waste your time on extra information. Subject-wise SPA practice, recall papers, mock exams, your performance analysis, and mentor guidance. So again, this is a reminder that we offered a limited time offer on our premium course, which is just for $100. Okay, how we can support you? We can provide you with the high live and recorded lectures, subject-wise mock exam, live interactive session, year-wise recalls, then Telegram SP discussion, performance tracking, and mentor support throughout your journey. Okay, is January 2027 worth it? Yes, absolutely now, because we are now enough motivated, I hope so, that we are going to give this exam. If you're really serious about your future, and honestly, what my mindset is quite different. It's not about to compete with someone or to be in the rat race. It's more about our personal growth. Uh, what I imagine, maybe after 5 years or 10 years, I would want to feel that yes, I have achieved something in my life and I do stand out. I do have something in my hand. So it's more for me, passing the exams is more about my self worth, you may say. So everyone have their own reasons, but yes, it would help to shape your future. So I wanted to share some real experiences, honest feedback, and it is a proof of guided MRCOG journey that you can see on the screen how we have so many happy faces, how our students they pass the exam in the first attempt. So we try our best to be with our students throughout their journey, not just with their curriculum or their academic support. We are always there to support them emotionally whenever they are burning out and they need some motivation. We are always there. So here you can see more and more feedback. So now we are done with the half part of our session. So if anyone have any question from the orientation of MRCG exam, from your curriculum and how to study the exam, you may ask me now. Otherwise, if you have no question, we can begin the introduction of biostats, which is a nightmare for the students. Should I go? Okay, so many students, they feel scared of biostats. And honestly, I also scared from biostatistics. But it is actually one of the easiest scoring topic if you understand the basic concept. You do not need advanced mathematics to solve the biostats portion in your exam. So don't worry about that. You only need to understand a few important ideas and practice questions. So don't be afraid from biostats, what I will tell you now. Okay, so what I have uh, analyzed from the previous years that uh, mostly students, they struggle with statistics. And why? Because most of them, they gave the reason that we cannot relate biostatistics, this module clinically. So we don't know whatever we are doing, we are studying or understanding or solving, and we are doing calculations. This is of no worth. We cannot understand that because it doesn't help us clinically. So today I would try to explain the importance of biostatistics in our health profession. So what is statistics? What is the idea behind that? Have anyone have any concept or orientation regarding biostatistics? What is this all about? Like if we imagine anatomy, we know what we are going to cover in anatomy, what is meant by anatomy. If we are going through physiology, if we're studying physiology, we know what is the idea of studying physiology. Similarly, if you are going to start biostatistics, what is in your mind? Dr. Nigat, usually our introductory sessions are usually for 1 hour, but I never minded the time. My main focus is that if all of my candidates are with me, they are following me, I don't hurry or mind with the time. So as far as everyone is clear, everyone knows the agenda, they are clear about the topics we are discussing. That sets the closure time for the session. Okay, so let me tell you what is the idea of statistics.
I'm sorry to interrupt you. Another question.
Yes.
Is there any
Yeah.
specific time of the day that we have to spare ourselves for the study session, or it's just the random?
Okay. As far as our free live sessions are concerned, we usually do them on the request of the candidates. Like, for example, if a lot of students they are asking about that they are facing challenges in embryology, then on the students' request, we arrange a live session, and we usually announce the date and time 1 week before. And for our premium course, we provide them with the full schedule. They already have there in hands that at what time and on what day which module is going to be covered.
Thank you for your answers. Another question. If somebody needs some class, like the person is busy somewhere and cannot attend, unfortunately, is there any recording session available for that person?
Yes, definitely. We once the live session is done, the team upload the session on the website. Whenever you have time, you can study at your own pace. There is no rush.
Yeah, that's a great answer for me. Thank you.
No problem. Okay, coming back to the statistics, what is the idea? So basically, in statistics, just think broadly that what we are going to do, we are going to collect data. Then From that data, we analyze that, and then we drive some useful conclusion. And from that conclusion, we make an impact on our clinical practice. And this is the idea behind all the guidelines which we are studying today. All of these are coming up from the experiments. I don't say the experiment exactly, but they came from the data collection, from the studies, different conclusions, different hypotheses, and then they are going to introduce as the guidelines. So this is the core of the medical practice. And if you know the importance of the biostatistics in the real time, then you can realize how important it is to understand the biostats. Because if you know that, then you can go with the research things, and then you know how when you're going through the guidelines, you know what is the idea behind that. Exactly, if we talk about the biostatistic, we refer to a fundamental role in modern healthcare, biological science, and medical research. So it is a core. From clinical trials to public health studies, researchers rely on biostatistical analysis to interpret data and make evidence-based decisions. And how a researcher or a doctor can do that? In the biostats, classically it includes different research studies, collection and organization of data, then analysis, submission of results, interpretation of the findings. So it plays a crucial role in research because it helps scientists understand relationship between biological variables, evaluate treatment outcomes, and quantify uncertainty in scientific findings. So this is why we study statistics. In a nutshell, what is the biostatistic pipeline? So broadly, just think yourself as a scientist or a doctor or health professional who is working on a research project. So how you're going to do that? So in a nutshell, what steps you're going to do? You would collect the data. And for data, you need some study design. You need to choose like what sort of study you are going to do with your data. And once you have that, you would do data analysis. From that analysis, you would make your inference. And once you do that, then you can make some guidelines. You can make a difference in public health and epidemiology insights. So this is how the biostatistic pipeline works. And now coming back to your exam, how you are going to tackle the questions and what is the high yield topics for your exam and what sort of question is coming in your exam. So there could be question from the study design. That means you should be knowing what are different study designs available. Then what is data and what is different type of data? They are very simple questions which comes from this domain. Then how would you do data analysis? So there are some formulas, there are some calculations. Then from inference, there are some calculations, but yes, you need to be very focused and exam relevant. Again, I won't recommend you to waste your time on studying a very big book of biostatistics. So be very precise when you are doing biostatistics. So let me begin the core concepts in biostats. So once you understand the concept, so whenever you are studying whatever calculations you are doing, whatever question is coming your way, you know what that words mean. So what is data? This is a very basic concept. Then what is variable? You trust me, when you are studying biostats, you will see these terms coming your way. What is population and what is sample? Then what is different types of biostatistics and what are biostatistical analysis? So the data forms the foundation of all statistical analysis. In the context of biostats, data refers to the information gathered through observation, measurements, or experiments related to biological or medical research. A very simple example I will give you that let me, like I gave Dr. Amara a task that she need to cover the data, like how many number of students in her class loves mango ice cream and how many students in her class they love maybe strawberry ice cream. So then she go and one by one and ask each student, like, what is your preference? And then she made a list of students who like strawberry ice cream and the list of students who like mango ice cream. And this is her data. So this is a very, I give a very simple example to understand the concept of data. And this concept you can apply on your research or your any experiment you are doing. So the next question is, now we know what is data. So what is the source of data? It could be either primary or secondary. What is primary data? The primary data is collected directly from the source. This is again similar to the previous example. Like if I give the task of asking individually about their ice cream taste preferences, this is the type of primary data because now she's collecting data directly from the source. It is original and very specific to the research. It is super valuable for drawing conclusions and making decisions. On the other hand, we have a second type of data, which is secondary data. What is secondary data, which is already collected by someone? For example, if I wanted to do research on a topic like maybe endometriosis, and I want to know how many of patients who are having endometriosis along with infertility, rather than going to each patient, I can use someone's already collected data, maybe from the hospital, maybe from the books, maybe from the Google, anywhere. So this is secondary data. It saves time and effort. And then once you have primary or secondary data, this data is further classified into major 4 categories. So classically 2 categories, which are further subdivided into 2 categories. And from this topic, there could be questions which come in your exam. And the questions would be very simple and straightforward. They might give you the example and ask you what type of data is this. So this is how you're going to cover this topic. By keeping this question in your exam, in your mind, you can start studying this and try to understand what are the different types of data. So broadly, we have 2 categories, the quantitative and the qualitative. Quantitative means something which is countable. That site is also known as numerical data. That means this type of data, you can calculate them. There is another tip to identify any data which have a unit with that. It is your quantitative data. For example, weight do have it has a unit with that. So that means it is your quantitative data. So these tips would help you to solve the SPA. So in quantitative data or numerical data, we have further 2 categories. One is discrete and one is continuous. So what is the difference between these 2? Both of these could have units. Both of these have numbers. But how we can assess that, is it discrete or continuous? So continuous data is that data can be calculated. It has an infinite number of probable values that can be selected within a given specific range. For example, temperature. For example, let me give you a very simple example, like weight of a car. So weight of the car, it could be 1000 kg, it could be 1000.2 kg, 1000.24 kg, 1000.248 kg. So there are a lot of numbers. The range is very wide. So it is your continuous data. On the other hand, it is discrete data. What is discrete data? That can only have discrete values. For example, how many number of guests come to my house? It could be 1 guest, 2 guests, 3 guests, 4 guests. Still, yes, they are calculable. I can calculate them, but they are not as continuous as the continuous data. So the numbers, there's another example, the number of students in the class. They could be 100, they could be 200, they could be 50, but there is no standard like in my class, there are 50.5 students. So there is no such thing exist here. So such type of data is discrete data. On the other hand, the continuous data, yes, it is calculable. I can calculate continuous data, but there's a wide range. Like, for example, temperature, it could be 100.2, 100.3, 100.4, 100.6, and so on. Is everyone with me? Are you able to know the difference between discrete data and continuous data? What is like, are you able to understand the concept? If yes, then I'm going to move on to the qualitative data. So the qualitative data, it is also known as categorical data. It is mostly about quality. It has no units. It is a big hint, like you can easily exclude the options from your question. Qualitative data, it is further divided into nominal data and ordinal data. Okay, nominal data helps to label variables without providing the numerical value. Nominal data is also called the nominal scale. It cannot be ordered and measured. For example, in nominal data, what can I give you? We have a number of people who are Manchester fans, and we have a number of people who are Portuguese fans. So these are the qualities. This type of data comes under the category of qualitative data, but it is a nominal data. How come it is different from ordinal data? Again, ordinal data, yes, it talks about the quality, but we can order them. How we can order them? For example, let me talk about the sketching skill. So in this skill, it is a quality, yes. Sketching is an art and it is a quality. So we can grade that this person has poor sketching skills, good sketching skills, excellent sketching skills. So now you can see the difference. You can not arrange the fans this way. Like Manchester fans are different, and the Portuguese fans are different. We cannot arrange them in any order. So this is a difference between nominal data and ordinal data. Some of the examples are for nominal data are letters, symbols, words, and gender. In ordinal data, the examples are, okay, I haven't written any examples, but like you can take any example, maybe the chess player. The chess player, we can grade them. We can make an order of such data, like this is a good player, average player, excellent player. Okay, in quantitative data, we classically talk about the quantities, the data which is in which we are able to calculate. The quantitative data further divides into discrete and continuous. Now, what is the difference between discrete and continuous? In continuous, the numbers can be have infinite probabilities. Like, for example, the weight of a car, it could be 1000 kg, 1000.1 kg, 1000.2 kg, 23 kg, 1000.234 kg. So this is how the continuous data goes on. There are infinite number of probable values. In discrete data, yes, it is still, I can calculate discrete data, but it has a definite number of possible values. For example, how many number of guests came to my house? How many numbers are there in the class? So they could be 1, 2, 5, 10, 100, but there is no such value like 10.5, 10.2, 10.3. There is no such existence. I hope now you understand the concept of quantitative data. And in qualitative data, it is classically about the quality. Quality. Okay, I have just made that clear that what is the difference between discrete and continuous. And the difference between nominal and ordinal is that, yes, we are talking about the quality, not the quantity. In ordinal data, we can arrange the qualities in the order, in a natural order, like more mild, moderate, fair. So these are the categories for ordinal data. But in nominal data, we cannot do such ordinal things. Like you cannot arrange the symbols in the order, right? Now, the next thing is to understand the concept of variable. Variable basically comes from a variable is any measurable characteristics that can take different values during a research study. In biological and medical research, variables often include a characteristic such as age, body weight, blood pressure, or disease status. So out of your data, in our data, when we are collecting that, we need to select a variable according to our study. For example, if I'm doing a research on how BMI affects how many number of people who have higher BMI later on develops higher blood pressure, hypertension. So in such case, I need to select a variable. What is my variable here? The BMI, the effect of BMI, which increases the risk on developing hypertension in future. So again, this is we select the variable from our data. So again, variable is any measurable characteristic that can take different values during our research study. Variables may represent numerical measurements or categories describing different groups. Understanding the nature of variable is important because it determines how data will be summarized and which statistical test should be applied during analysis. So again, for variables, the things are similar. The types of variables, again, we have quantitative and qualitative. And now if you know what is quantitative data and qualitative data, you will be able to understand what are quantitative variables and what are qualitative variables. Both are the same things. There's no difference. Then another thing we came across while studying biostatistic is population and sample. What is the concept? The population in your study, whatever the research you are doing now, and keep in your mind you already go through from the topic of data. Now you have your data in your hand, and from your data, whatever you are studying, you are doing, you need to select a population and a sample to carry on your study. So how would you select population from your data? So population refers to the group of individuals, items, or observations that share a common characteristic and are the subject of study. It is referred as population. The population is a complete set from which a sample is drawn. What is sample? Sample is a subset of population which helps to gather information about the population without having studied every single element within it. For example, when we are doing biostatistic analysis or whatsoever, for the calculations we need numerator and denominator. So this population and sample implies on that concept. So over population, whatever the scenario is, whatever the research is, we select the population and we put that in denominator, and the samples go in the numerator. When you later on, when you start studying epidemiology, when you start practicing questions, you would know, like make sure this habit whenever you see a calculation and you see some value on numerator and denominator, you know what is population here and what is your sample here. And this concept would help you to understand different definitions on your way. So in general, population is the entire group under study. For example, I have gathered some data. The patients who I'm trying to study, maybe the patients who have developed maybe lung cancer due to cigarette smoking. So that is my population study. Sample subset selected from that particular population. Maybe I would select some population who are doing smoking. So that would go in my sample, and I would compare that by the rest of the population, which goes in my denominator. Now, the next thing is, what are the types of biostatistics? When discussing what is biostatistics and its type, the field generally relies on two major statistical approaches. One is descriptive statistics and one is inferential statistics. And why I have added this slide, because when you are solving SBAs, you will get some questions from descriptive statistics, and there would be some calculation and questions from inferential statistics. And why I'm trying to make up your mind, because if you know the basic logics, you know the things, how you can imply them practically, then it would make you, it would help you to solve the SBAs more easily, rather than just randomly solving questions. These approaches make a core framework of biostatistical analysis used in biological and medical research. So in descriptive statistics, how Again, I would try to recap everything along wise. First, what would be your first step in pipeline? You need to gather the data. How would you gather the data? That could be primary, that could be secondary. And once you know the data, you need to select your variable in your study. And you need to understand what are the different types of data. It is qualitative, quantitative, discrete, continuous. You know these categories very well. And once you have the data, you has made a study design, then now the point is, how would you analyze your data? And for your data analysis, you need some type of statistic studies. And classically, what we usually use, we use two approaches. One is descriptive statistics, and second is inferential statistics. Now let's just focus on descriptive statistics. Like again, keep in your mind you have that data collected. And now what you are going to do, you are going to do analysis, biostatistical analysis on that data. And you are following the method descriptive statistics. So how you're going to do, what you are going to do now. So ask yourself, try to relate things practically. That yes, I have this data. Now I'm going to do a research. This is my mind. I have selected my data. I have selected my variables. Now I wanted to analyze my data, and what method should I follow? Now I have selected descriptive statistics. So how I'm going to analyze. So these are the things we are going to analyze. So this descriptive statistics focusing on organizing, summarizing data so that patterns can be clearly understood. Researchers often present this information through average, percentages, graphs, summary measures that describe the characteristic of a data set. Following are the types of descriptive statistics. So what you're going to do, the very first step in descriptive statistics, you can measure the central tendency. And here are your other SPs. There are a lot of questions in the recalls which comes from the measure of central tendency. So how would you measure central tendency? You are going to calculate mean, median, and mode of the data. What is mean? Mean is the average of a set of values, or mean is considered the arithmetic average of a data set that is found by adding the numbers in a set and dividing by the number of observations in the data set. Although this seems like a bit tricky, but I will summarize this in the coming slide, like how you can simply, in just 30-second or 40-second time, you can calculate mean. Then what is median? Median is always a middle value when the data set is listed either ascending or descending order. Then we have the mode. What is mode? It is the most frequently occurring value, that is the number that occurs the most in the data set and ranges between the highest and lowest value is the mode. What else you are going to do in descriptive statistics? Yes, how would you analyze your data in descriptive statistics? One thing, you can analyze your data by measuring the central tendency, in which you calculate mean, median, and mode. The second thing is you can measure of dispersion. In measure of dispersion, the questions which comes in your exam is they could ask you about the range, they would ask you to calculate variance, they could ask you to measure central deviation. So these are the categories for the measure of dispersion. Then the third thing is frequency distribution. So these are the things you have to utilize or you need to follow in order to analyze your data in descriptive biostatistics. Is everyone with me? Any confusion so far? And these are your questions from the recalls. You can get any question, maybe from the measure of central tendency, maybe from the measure of dispersion. There are no such questions from the frequency distribution. However, the first one, the measure of central tendency, this is very important, and measure of dispersion, this is very, very important. All of you must know how to calculate them from your data. Is that clear? Now here is your calculation portion. Some of the questions comes from the conceptual point of view, and some of the question comes from the calculation. Then we have another type of statistical analysis, which is inferential biostatistics. In inferential biostatistics, It is used to interpret the meaning of descriptive statistics after the data has been collected, analyzed, and summarized. That is, the inferential statistics describe the meaning of collected data. And what are the things which are included in inferential statistics is hypothesis testing, confidence interval, regression analysis, probability testing. And all of these have their own formulas to calculate. Now you have a second group of questions for your exam. There could be a question on hypothesis testing. There could be question on calculation of confidence interval, and trust me, there's definitely gonna come one question which comes for the calculation of confidence interval. It is a very high yield topic. There could be question from probability testing. So here is a comparison between descriptive and inferential biostats. So purpose for descriptive statistic: to describe and present data clearly. As far as inferential is concerned, to test hypotheses and make population level conclusion. Datascope for descriptive work with data that has already been collected. In inferential, it uses sample data to generalize results to a large population. Common methods for descriptive statistics, we use mean, median, mode, frequency tables, graphs, standard deviation. So just note down these points that at least you should know the formulas for these calculations. On the other hand, for inferential statistics, what formulas you should be knowing: hypothesis testing, confidence interval, regression analysis, and probability testing. So I think if you are able to calculate all of these, you can cover all of the SPAs from the biostat in your exam. This is very high yield. Is that clear? Okay. Then the types of analysis, it describes patterns within the data, and inferential determines the relationship and statistical significance. Then let me give you the example for descriptive statistic is calculating the average blood pressure of patients in a study. On the other hand, for inferential, testing whether a new drug is significantly lowers blood pressure compared to a control group. So this is the importance of biostatistical analysis, that it is widely used across the healthcare, medicine, and life science. Researchers apply statistical techniques to biological data in order to evaluate medical treatments, identify disease risk factor, and assess the effectiveness of public health programs. So this is the relevance of biostatistic in your curriculum. So now onwards, whenever you see biostatistic anywhere, maybe in your practice, maybe you are going to do a research, or you're writing any exam in your life, you know what is the idea behind that and how it is relevant in our daily life, how we can implement this in our professional life. I hope I made my point clear regarding the significance and understanding of biostats in our curriculum. So here's are some other concepts of measurement. So you should keep these main points to when making a measurement, that your measurement should be accurate. So accuracy should be there. A measurement is accurate if it matches the exactly and accepted standard. Precision should be there. A precise measurement is one that has a small random error. Reliability. A reliable measurement is one of that can be repeated within minimal variation. Then your measurement should be valid as well. A valid measurement gives a genuine information about that which is being measured. So these 4 points are way more important when you are actually doing a research. So let's calculate mean, median, and mode. This is for your practice. And if you understand this by now with me, there is no need to study this topic again, and you can solve any question in your recalls or in your curriculum from this topic. So again, mean, median, mode, from where these concepts are coming from. This is from the this is the measurement of central tendency in our data. So here you can see measures of central tendency, how we are going to do by calculating mean, mode, and median. For example, we have a data set 7, 3, 4, 1, 7, 6. So how we are going to find out mean? So from this data set, if I wanted to calculate, I have this SB in my exam and I have this data set in my question, and they asked me to calculate mean. Now I want to solve that SPA and find my answer. How I'm going to do that? I'm going to add all of these values and divide them by their total numbers. For example, we have 1, 2, 3, 4, 5, 6. We have 6 numbers in our data. So we will add all of these values and divide them with 6. And once we do that, we will get our mean. And that is your answer, and go and mark your answer in the exam. On the other hand, there could be a question on the finding mode in the data set. So now looking back to this data set, I need to find out what is mode, which is the most common value. And here I can see 7 comes 2 times. So this is my mode. That is a simple one to find out. The third thing is the measurement of median. If in the exam they will give you this data set and ask you what is your median in this data. Here the mostly students say, okay, there are two major mistakes the students made. One mistake is that while calculating mean, what they usually do, they add up all values and divide them with 2, which makes them their answer wrong. So don't do that. You need to calculate all the values and divide by the total number of dataset values. The second mistake mostly students made, they calculate median without arranging the data in ascending or descending order. So in order, if you want to find out the correct answer, you need to, first of all, you need to arrange your data in the ascending or descending order. And the middle value would be your answer. In case, if the middle one is not there, you can simply add up the middle 2 values and divide them 2, and you will get your answer. So this is how on graph your measure of central tendency would look like. This is your data which you have collected. You presented that in the bar diagram form. And now you can see here your mean, median, mode lies. And this is the measure of your central tendency. Is that clear? And this is a normal distribution curve. Make yourself familiar with these curves. If you see any curve like that, this is your normal distribution curve. What does that mean? In a normal distribution curve, as you can see that the data is symmetrically distributed with no skew. So the data is equally divided between the measure of central tendency. Is that clear? Okay, why we divide with 2? Because if you have, your data values in odd numbers, then yes, it is very easy to find out the central value, which is your median. But what if your data is in even numbers? What you're gonna do that in that case? So if the data is in even numbers, then you need to add up the middle 2 values and divide them 2 so that you can get your exact answer. Okay, this is for your orientation for the graphs. This is a normal distribution curve, because if you understand the curves, then you can go with the further calculations of standard deviation and the rest of the things. So this is a normal distribution curve. What does that mean? That means the data is symmetrically divided on each side, as you can see here. What is skew? I hope when you start studying maybe essential revision guide, you will come across with these terms. So what is skewed distribution of the data? As you can see here it is very obvious the data is not symmetrical. It has a tailed appearance. This is known as skewed distribution. It could be on the right side. This skew, this is what I meant by skew. The data is not equally distributed. You can see how mode, median, and mean, they are not on the top of each other. So it could be positive, it could be negative. In positive skewed distribution, there is cluster of lower scores spread out tail on the right side, as you can see here. In negatively skewed distribution, there is cluster of higher scores, which are spread out tail on the left side. So this is a positively skewed distribution. And this is the diagram of the negatively skewed distribution. So in this histogram, as you can see, your distribution is skewed to the left side. And the central tendency of your data set towards is the higher end of the possible scores. Here you can see this is exact opposite to the positive skewed distribution. So another thing to highlight here, in positively skewed distribution, as you can see here, mean is usually smaller than median, and median is smaller than mode. This is the order you need to remember. However, in negatively skewed distribution, you can see your mode is smaller than median, and median is smaller than mean. So these are the two key points you need to remember from the skewed distribution. There is another term which I haven't added in my presentation, which is on kurtosis. So all you need to just have an idea, what is a normal distribution curve, what is skewed distribution curve, which I have just shown you, and the third thing is kurtosis. There is no question in your exam on kurtosis. However, just for your sake of knowledge, that whenever you came across with this term, you know what is kurtosis. So in kurtosis, it basically measures the height of distribution. There is no right or left. It usually measures how high is the peak of the values in your data set. So that is just a simple concept regarding kurtosis. Or in simple words, it measures the tailedness of the distribution. It is that is commonly used in statistics or maybe physical science. And also the concept of kurtosis, it usually is sensitive to changes in the center and shoulders of the distribution. So it measures the height, basically. So I hope I made the basic concepts. I tried my best to make them as simple as possible. So now is the time for brainstorming what you have understand so far. So I'm going to give you activity. You need to find the mean, mode, median, and range for the following list of the values. So you have you can take 1 minute of time. I will give you 60 seconds to solve this question. And in this question, you need to find out mean, mode, median, and range. I know I haven't tell you the formula how to find out range, but I wanted all of you to do some brainstorming. Don't worry, nobody's judging you. If you don't know the right answer, don't worry, but try to make an attempt. And please type your answers in the following format so I can check them easily without any confusion. So you need to write your answer in the following sequence. First of all, mention mean, mode, median, and at the end range. So your time starts now. Okay, the time is over and I haven't received any answer. Anyone else? Please try to, okay. Okay, what I was trying to say, if you understand and solve this at the moment with me, trust me, You will remember this till your exam, and there's no need to spend extra time on this topic. And these questions repeatedly come in the exam. Sometimes they ask you to calculate all of these measure of central tendency. Sometimes they will just ask you one, maybe mean, mode, or median. Okay, I'm going to show you the answer slide. Okay, so 15, 13, 14. Okay, that's excellent. Very well done. Those who won't able to give the correct answer, don't worry. We will solve this together. That's wonderful. I think I give you the less time to solve this question. That's wonderful, wonderful answers. Okay, so we have the data 13, 18, 13, 14, 13, 16, 14, 21, and 13. So first of all, what was our question? To calculate mean. So, okay, one more thing, what we can do, anyone, you may volunteer and explain how to solve these questions. Anyone? Okay, I think nobody's ready to volunteer to explain how we are going to solve these questions. Okay, so for mean, first question was to calculate mean. What we are going to mean, what is the formula? Don't worry if you forget the concept of mean, but yes, it is, to keep things simple. What we are going to do, we just add up all our data values and divide them with the total number of data set. So we have 1, 2, 3, 4, 5, 6, 7, 8, 9. We have 9 numbers. So we add up them, divided by 9, the answer is 15. So all of you who have given 15 as the answer, well done. The second question was to calculate mode. Mode is the number that is represented, that is repeated more often than any other number. So let's find out what is the most repeated value. So we have 13, 13, 13, and 13. So that's why 13 is our mode, which is the most repeated value. So 13, all of you were correct regarding mode. Okay. Then we have median, which is a bit tricky. In order to calculate median, we need to organize our data in ascending or descending order, preferably in ascending order. So we have arranged our data in ascending order: 13, 14, 16, 18, 21. There are 9 numbers in the list, so the middle one will be our median. So here we have 1, 2, 3, 4, and 5. So fifth one is our median, which is 14. Okay, this is a simplified version. However, when you open up the books or whenever you study this topic from any book, you will see they made this topic very complicated, and they provide with a very complicated formulas to calculate mean, mode, and median. However, this is the simplest approach, and we have a lot of things to memorize, so we don't waste our time on unnecessary formulas. So keep things simple and understand this way. You can ultimately get the correct answer. No worries, Dr. Safia. Okay, so the last one was how to calculate range. Wherever you get a question on calculating range, all you need to do to take the largest value and the smallest value and minus the smallest value from the largest value, and you will get your answer, which is the largest value in our data set was 21 and the smallest value was 13. So 21 minus 13, you will get your range, which is 8. So 15, 13, and 14, 8, this is the key for the question. Is that clear? So you have successfully covered your topic for your MRCG Part 1 from Biostatistics, which is uh, your measure of central tendency. Okay. So this was a demo lecture from Biostatistic, and I tried my best to give you all the tips, like how you are going to study from the theory books, what information exactly you need for your exam, and how you are going to utilize them according to your exam questions. And this is the same way you are going to cover rest of the biostatistics and rest of your modules. Am I clear? Okay, any questions? Okay, if I have missed anyone's question, please you may ask me again. And I know I took a lot of time, but this is my thing. My lectures are usually very long because I try my best to match everyone's pace because each students have their own requirement there or their own pace of study and understanding concepts. So that's why I try my best to keep everything slow and keep my students along with me during the sessions. So thank you so much for bearing with me so far. Okay, so on the last note, I encourage everyone to stay focused, ask questions whenever you are confused, and please practice regularly. And by the end of this session, I hope you will have a better understanding of why MRCG is worth pursuing and why biostatistic is an important and manageable module in your exam. So thank you so much. Goodbye. See you soon. Anytime, Dr. Amara.